Hi, Chris Milburn here with a short message as requested from Dr. Vora. I'm a family and emergency room doctor, but I've been doing work a day to a day and a half a week with complex injured workers since 2006. During that time, I've seen it'd be in the thousands now of patients who have been bouncing through the workers' compensation or car insurance system for up to several years, but generally many months. And so I have a unique view on what we're doing as doctors that helps and harms patients. It struck me as really interesting when I started doing my job that I would have large numbers of patients from a particular family physician who would end up in my clinic who were chronically disabled, and almost none or literally none from other family doctors. And these were doctors in the same community with the same size practices and the same patient demographics. What I figured out fairly quickly was what some doctors were doing, and what I had been doing was making patients fearful of activity. I had been focusing on what were the bulging discs on their scan, what were the things that they shouldn't do, what were the things to worry about and to watch for in terms of symptoms and to be constantly aware of. And I put all those negative messages in their head and then sent them out the door and expected them to get better. Now, there's many patients who probably will get better anyway, even if we do that. But for some patients who may have conflicts with work, stress at home, depression, anxiety, and are very focused on their symptoms, the worst thing that we can do is focus them on the things that make them feel less safe to move. And there's a lot of research now in pain medicine to say that the more we focus people on their pain, the more we focus people on things like bulging discs on scans, the more pain they feel and the less likely they are to get better. So I think we can do a lot through our words. I don't use words like degenerative disc disease because it's actually normal aging change. I don't use wear and tear because wear and tear doesn't wear out body parts. Body parts are healthier with movement. So I don't use these things. I encourage people that being fit, being active, and being strong are the best things they can do for themselves. Restricting their activity, staying off work long term, and the deconditioning that comes with that is the worst thing they could do. And so I've really changed my messaging over the years. I've kind of figured out what it was that those family doctors whose patients never seem to get disabled were doing, and I've tried to adopt that as best I can.